All right, so this presentation has to do with substance use disorder, specifically when it comes to prescription opioids and physical therapy. So to start out, what exactly is a substance use disorder? So substance use disorders are prolonged, repeated use of substances at high doses and or frequencies that significantly impair health and function. So these substances can be legal, like nicotine or alcohol, illegal, or controlled for use by prescribers, so prescription opioids fall under that category. There are also 7 classes of substances. They include nicotine, alcohol, cannabinoids, depressants, stimulants, hallucinogens, and again, opioids. So the Diagnostic and Statistical Manual for Mental Disorders, 5th edition, they have a diagnosis criteria for substance use disorder. These include increased tolerance, increased dose or taking for longer than required, withdrawal symptoms, cravings, continued use with knowledge of danger, continued use with the knowledge of exacerbation of physical or psychological problems, the desire to quit but unsuccessful attempts, an increase in time to acquire, use, or recover, giving up important activities to use, continued use with the knowledge of the effects that it has on personal relationships, and then failure to fulfill those life role obligations. So substance use disorder can be categorized under mild, moderate, or severe. 2 to 3 of these diagnostic criteria result in mild substance use disorder. 4 to 5 would be moderate, and then anywhere from 6 to 11 would be considered severe. So, why do we get addicted? So, dopamine is the neurotransmitter that's responsible for a feeling of pleasure. That can be in response to food, drink, sex, socialization, really just anything that brings you pleasure in life. In the ventral tegmental area, opioids stimulate a release of dopamine to the nucleus accumbens, which results in those feelings of pleasure. Another area of the brain, the locus ceruleus, is the area of the brain responsible for stress, and it is responsible for releasing noradrenaline, which controls our sense of arousal, alertness, and wakefulness, among several other things. So consistent opioid use throws off the balance of this system by increasing the amount of noradrenaline. So when this happens, opioids are the only thing that is able to suppress those feelings of stress, and when a person's not using, those feelings are so high that they experience withdrawal symptoms. Some common withdrawal symptoms include jitters, anxiety, muscle cramps, and even diarrhea. Another thing that opioid use does is increase the levels of the stress hormone, cortisol. So with higher levels of stress, that just reinforces the dependency and a patient's compulsion to use. Neuroplasticity also plays a role in addiction. Neuroplasticity is the brain's capacity to change and adapt in response to physiologic changes, and those changes are a response to the modification of the patterns of our thoughts and behaviors. So decreased dopamine and the increase in noradrenaline results in a decreased feeling of pleasure, and that is responsible for increasing a person's cravings and also increasing those symptoms of withdrawal. A couple other terms that you may hear are long-term potentiation, which is an increase in the strength of synapses within the brain, and long-term depression, which is the opposite, a decrease in strength of those neural synapses. So whenever this happens, this leads to changes in the neural pathways, and a new normal is established within the brain. So while these changes can be a negative, there is room for them to improve. So patients who are willing to buy in, stay motivated, and educate themselves can often have positive outcomes in treatments. So why are opioids a poor choice for treating musculoskeletal pain? In a 2015 study, it was found that 92 million Americans who use prescription opioids, and 63% of those people took them to relieve pain. With so many people taking opioids, we've learned that they're highly addictive. So 21 to 29% of those prescribed opioids eventually misuse, so you can think of that as 1 out of every 4 people will misuse. Then another 4 to 6% of those who misuse eventually end up turning to heroin. Pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. This tells us that the brain plays a role in the production of pain. So it has been shown that in patients with chronic pain, opioids, when compared to other treatments, have not been shown to improve pain-related functions. They also have been shown to lead to opioid-induced hyperalgesia, which is an increased sensitivity to pain due to the opioid use. You can think of this as the more opioids a person takes, the more pain they'll experience. And then it's also been shown that pain is very complex, and it's a multifactorial relationship between the pain we are physically experiencing, our environment, and our behaviors. So why is physical therapy the best choice? Physical therapists get to spend a lot of time with their patients, and that provides the opportunity for treating the person and not just the condition that they present with. Physical therapists are great educators. They possess the knowledge and the skills necessary to educate their patients on the science of pain and stress management. So a saying that goes with that is no pain, no gain, meaning that when you're able to understand some of the neuroanatomy and neuroscience behind pain, you are able to have more positive outcomes because of your knowledge on your pain. This helps to increase a patient's self-efficacy, and it offers them greater hope that they can improve. The other role that physical therapists serve is to offer interventions in the form of exercise with a focus on improving conditioning, strength, and mobility, and then also manual therapy techniques to manipulate the joints and soft tissues, which helps to modulate a patient's pain and increase their mobility. So with the number of Americans who use prescription opioids yearly, the costs really add up to $78.5 billion a year. Whenever people with chronic pain seek treatment from physical therapy first, this lowers those healthcare costs by lowering the utilization rates of advanced imaging such as MRIs, injections into joints, surgeries, and again, the prescribing of opioids to treat pain. And here are the references cited throughout the presentation if you're interested.